Hello, it's Dr. Rhonda Johnson. Today is Tuesday, October 3rd, 2023, and today I'm talking about SARS Cov-2 infection and the heart. And the article I'm talking about was published in Nature on September 28th, 2023, funded by the National Institute of Health. And basically, the research shows that the SARS-CoV virus can directly infect the arteries of the heart and cause the fatty plaque inside those arteries to become highly inflamed. Now, the study was conducted on a small cohort of older individuals, 8 patients, who were hospitalized with COVID-19. The median age was 71. 75% of the patients were male. All had coronary artery disease and 3 or more cardiovascular risk factors, such as high blood pressure, overweight or obesity, hyperlipidemia, that's high cholesterol, type 2 diabetes, chronic kidney disease, and some had a history of a heart attack or stroke. Now, we already know that previously published studies have shown that the SARS-CoV-2 virus can directly infect cells such as the brain, the lungs, and the gastrointestinal tract cells. What this research showed is that this virus can infect and replicate inside coronary blood vessels, induce plaque inflammation that could potentially trigger acute cardiovascular complications and increase the long-term risk of heart disease. Now, in their discussion, the authors note that although SARS-CoV-2 is considered a respiratory virus, it still can infect the heart blood vessels and elicit a strong inflammatory response. The authors do state that their research is only relevant to the original strains of the SARS-CoV-2 virus that circulated in New York City between May 2020 and May 2021. And that ancestral strain is long gone, folks. They also note that their study was conducted in a very small cohort of older individuals, all whom had atherosclerosis, that's the plaque in the arteries, and other medical conditions. The authors state their results cannot be generalized to younger, healthy individuals. Why am I taking the time to point this out? Because, folks, if you've had COVID-19, and some people have had it 3 or 4, 5 times now, and now we're in the Omicron strain. We're not in the original virus strain. So you can't apply the results of these findings. You cannot, because you're just guessing. You can't draw those conclusions. That's the bottom line. But so why is it important? Well, it's important because since the early days of the pandemic, people have known that if you've had COVID, you're at an increased risk for cardiovascular disease. And this study may show the reason why, because of these macrophages can get infected in the heart and cause this inflammation. So here's another one of my comments. This is my opinion, that it's another study that shows that COVID-19 is not the common cold or the flu. I also want to remind people, do not conclude that you're at an increased risk for cardiovascular events if you've had COVID-19, you're young and healthy. Don't generalize this study beyond what the study has shown. You also cannot make any inferences about the COVID-19 vaccines because this paper does not have a single mention of the COVID-19 vaccines in it. And remember, between May 2020 and May 2021, very few people would have had 2 COVID vaccines here in the United States, in New York City, because the vaccines were just being rolled out basically in the early part of 2021. And we already know that people who have these risk factors such as hypertension, cardiovascular disease, obesity, type 2 diabetes, hyperlipidemia, high blood pressure, chronic kidney disease, they are already at an increased risk for COVID-19 outcomes. This study did not have to prove that. We saw that in the real world in terms of real people evidence. So these folks already know they're at higher risk. So that's my message today. I hope this study is helpful. And take care, folks, and be safe.